We want to thank our primary sponsor and my employer by day, Nassau Financial Group. Our tagline is, working harder to be your carrier of choice. We support you with best-in-class service. We seek to keep things simple, and we'll have your back in the years to come. We're headquartered in Hartford, Connecticut, with $27 billion in assets and over 500,000 policyholders. We've been doing this a long time, 170 years, but we remain humble enough to always try to improve.
Welcome to That Annuity Show, the podcast that will make you an expert in explaining annuities to your clients. Give us 30 minutes each week and we'll shave hours from your client presentations. Now, here's your host, Paul Tyler.
Hi, this is Paul Tyler, and welcome to another episode of That Annuity Show. Mark, how are you?
Paul, I'm doing great, thank you. How are you doing today?
Excellent. Ramsey, seeing you in your regular spot.
Yeah, it's great as always to be here. It was even better when the two of you were down here in Atlanta with me last week, and we were recording and hanging out the Rolling Stones concert. That was a real treat.
That was an amazing event.
That was exceptional. It was remarkable how well we've done, over the last, year and a half doing this remotely. It was great, even better to be in person. And just kind of soak in the energy and the music and wow, talk to a lot of people in the business there, right? Who come as guests of the Alliance for Lifetime Income, right?
No doubt.
Great fun. It was a lot of fun. Now, speaking of associations, we didn't actually do this intentionally, but it's a real interesting segue. So today we have another special guest, Jesse Sloam, who is the director of the Long-Term Care Association, the Medicare Supplement Insurance, and Critical Illness Insurance Association. Jesse, welcome.
Thank you. I didn't know tickets to the Rolling Stones were included when you signed up to do this broadcast.
Well, no.
They work with last week's show, unfortunately.
Yeah, so Jesse, what big rock group is your association sponsoring this year?
Yeah. It's just too bad that the Stones finished their tour in SoFi Stadium here in LA. So.
Yeah. Well, why don't we start with? We're happy to kind of cover the waterfront of a lot of the issues you're in. I think, first of all, very interesting in terms of the community you've built. And we talked a little bit about this before the show. In fact, how we came to know you was through your Medicare Supplement conference you hold every year. And I'm telling you, man, if you're in the business, Jesse, you have to be there at your conference, right?
All the associations start with the preface American Association. So, yes, the American Association for Medicare Supplement Insurance runs what is now an annual conference. And it is the industry conference that has historically focused on Medicare Supplement, primarily because that is still an overlooked segment of the whole Medicare marketplace. So the industry wanted an event that really focused on MedSup. I will share with you that as Medicare is changing, as the industry is changing, so will the future conferences. It's just natural that it will start to expand and focus on Medicare Advantage, since MA plans are now, significantly larger. By next year, I'm going to say there'll be 2 for 1, 2 MA plans for every one MedSup plan, and so really? It's a very important part of what's taking place for agents, brokers, for the industry, and for consumers as well.
So, Jesse, can you just break down the difference between the MedSup and Med Advantage programs for the audience?
You mean conference, or just in general the MedSup? Well,
just in general, in terms of the plans.
Okay. So the Medicare Advantage is basically you're making the choice that instead of having original Medicare A and B, you are now picking a plan typically run by an insurance company, an Aetna, United Healthcare, could be a quasi like a Kaiser, and you are looking at them and saying, I'm turning to you for my healthcare needs. And they are providing. Those are the ones that if you turn on the television and you see Joe Namath, or you see Jimmy J.J. Walker, Mr. Dynamite, talking about you can get all this wonderful coverage, and you can even get dental and prescription and meals and God knows what. You're going to get everything from your Medicare Advantage plan. Basically, what Medicare does is it gives the plan a set amount of money, and they have to then control their costs or work within that budget. So and you are within that network. If you choose to keep just your original Medicare A and B, you have the choice to add a Medicare supplement insurance, and those are the plans with various letter names, and those plans supplement Medicare A and B. The benefit of those that many people find preferable is, one, you don't have to be part of a particular network. You can see any doctor specialist who accepts Medicare, etc., and you have your choice. So there are pros, there are cons for each. A lot of it is often driven by where you. In a more urban area like a Los Angeles or an Atlanta, you generally, that's where those health centers, the big plans are focused because the population is focused. If you're in a more rural area, you won't have a big Kaiser facility on every street corner. So there's a little bit of each, but there are definitely trends in the country.
Yeah, so why is Medicare picking up a head of steam? You said now, it's these plans are going to be sold this coming year at a rate of 2 Medicare Advantage plans to 1 Med Sup plan. What's changed in the marketplace, to make that more attractive?
Currently, I would say the federal government is favoring. They would never say this, but they are, to a degree, favoring Medicare, directing funding towards Medicare Advantage, allowing the Medicare Advantage plans to add all these wonderful benefits. So as I say, if you're a consumer watching, Judge Judy or CNN or MedSup, or even if you flip through your cable channel, and remember, young people watch everything on their phone. Seniors still tend to watch, traditional TV. You'll see whole channels that are, sign up, learn about the Humana plan or United Healthcare. So they're giving, the government is giving, I would say, incentive to these plans because there they can control the cost. They say, well, we're going to give you $20,000 for everybody. You figure out how to provide care for $20,000. With Medicare Supplement, there's no cap. If I wanted to spend every day of my life going from doctor to doctor to doctor, I could. And each of those doctors would then bill Medicare. So there's some sort of, that's the assumption of why the government is directing this currently. Now the question is at what point does, do fiscal things come into play, and they look and they say, whoa, we have to curtail.
So in the sales cycle, Jesse, do you find that an agent will go in with both plan offerings and let the client select, or they typically focus in on one or the other?
It depends. There's extra, it's harder and more limiting to sell Medicare Advantage. CMS, Center Medicare, controls puts very strict requirements on what you have to do in order to sell MA plans. It's quite limited and quite restrictive. A lot of agents don't like that. A lot of agents like the opportunity to sell and offer their clients both. I would say it depends on the agent. It depends on where they are. It depends on how long they've been selling. I was watching chat on a chat board where a bunch of agents were talking to each other and saying in 5 years, if you're just selling the Medicare supplement alone, you will not be in business. Well, that depends. If you are in, rural Nebraska, where there is not going to be an MA plan really competitive with you, you're going to still be in business selling MedSup. If you are in downtown Los Angeles, that's you're going to, your MedSup population is going to be limited to middle class, upper middle class, etc. So they're continual trends. I would look and say, for the next 5 years, if an agent were just starting out and getting into the Medicare space and asking me for advice, I would look and say, if you have good MA plans to choose from, you better be conversant in them and offering them. If you don't, then you don't need to do that. If you are looking to build a call center or an online presence, you need to obviously have both.
Interesting. Now, late breaking news after we scheduled this, I pull up the news and literally headline is Medicare Part B premium increase for 2022 is the biggest ever. We're a little farther down. The rates are increasing 15%. Now, Jesse, maybe explain to us, what does that mean if I'm an agent working with a consumer? Does that accelerate the trend towards Medicare Advantage, or does it slow it down and people start to say, maybe I want to have that deductible and have some freedom to go where I want to go? Does it change anything?
It's going to change a lot. It's a big jump. Now, again, those rates are tiered. So if you are at the lower, if you're retired and your income is relatively low, your Part B premium, is going to be negligible. But there's always going to be a breaking point where a consumer looks and says, I'm tired of paying. Basically, the money comes out of your Social Security check. So I'm tired of paying, and I'm seeing all these, if I sign up for a Medicare Advantage plan here in Los Angeles, I can get free prescription drugs. I can get I just wrote an article that posted yesterday on Yahoo about the different dental benefits. Currently, there's no spreadsheet that compares the different dental benefits. So I actually started talking to producers. Well, because the ads all say, we give you free dental. That's true, but it's all in the contract. Well, one company, has certain limits. But one company will offer you $1,500, up to $1,500 a year, to use with any dentist you want. Another one will actually cover implants, up to $2,000. So now you're really starting to talk about, serious benefits that these plans are offering that they're using to compete with each other. So, hell yeah, it's going to have an impact.
But Are these things, pardon me, are these things that wouldn't be available under the regular Part A, Part B plus supplement? They're not available.
Yeah, no, they're not available under Part A, Part B supplement. Supplement plans, it's at the conference, I've asked companies, how will you compete going forward? When your competition is giving away so much for free. Now, granted, they're looking to do things, but it goes back to, it's sort of, you were asking me before about, you said I head up the long-term care insurance. Well, long-term care insurance sales today are negligible. Traditional sales in 2000, 2001 were about 750,000 policies a year. This year, or last year, they were about just under 50,000. Why is that? It's not because people are getting younger or not getting older. It's not because they need less long-term care. It's because basically insurance companies manufacture products and then they go to others and say, market and distribute them. That's the way the insurance industry works. It's very similar off a multi-level marketing model. It's like Amway. Amway is very successful. Sometimes people don't like the connection, think that that's degrading, but that's just the way many insurance products are marketed. So part of the reason that long-term care insurance is not being bought or sold today is that the consumer just doesn't look upon it favorably. Medicare Supplement runs the risk of exactly the same thing. I have no idea how many tens of millions, perhaps hundreds of millions of dollars. I'll ask the three of you, show of hands. How many of you have seen the Joe Namath commercial?
Oh, yeah.
On TV?
Yeah.
Probably
multiple times a day.
Okay. You've not seen one really commercial that you can remember that focused on the benefits of Medicare Supplement. So if it comes back down. If the consumer sees all of this wonderful stuff for free, they will slowly migrate, which is what is happening. It's not.
Thanks for listening. If you've enjoyed the show, please rate and recommend us on iTunes, Stitcher, Overcast, or wherever you get your podcasts. You can also get more information at thatannuityshow.com.